First, do no harm. This is one of the most important principles in the practice of medicine. It reminds healthcare personnel to consider the possible harm that any intervention might do. It enforces that, given an existing problem, it may be better not to do something, or even to do nothing, than to risk causing more harm than good. So, how do we teach knowledge of similar characteristics in the best possible way? I am Eduardo Viteri from Ecuador, and teaching principles is the subject of this module. But what is a principle? Cataract is a fundamental aspect to teach to ophthalmologists. As you all well know, many things must be taught in order to properly train an eye surgeon to approach these cases in a safe and efficient way. And these aspects should be classified according to the contact characteristics. So we have facts like cataract prevalence, or concepts like lens opacities, the process of IOL calculation, the procedure itself, the surgery, and there comes the principles. When to operate, what kind of IOL are you going to use? So each different content should be taught in a different way. The objective of this module is to recognize principles, its different types, and how to teach them effectively and efficiently. I have no relevant conflict of interest with the content of this module. In order to achieve these goals, we will go through this content: definition of principles, different examples, how to teach them, and the learning and teaching sequence. I'm sure you remember, do no harm. It is invoked when debating the use of an intervention that carries an obvious risk of harm, but a less certain chance of benefit. How can we define the characteristics of this kind of knowledge? In a few words, principles are guidelines or criteria that can direct you in similar situations. Unlike procedures, there are no automatic or mandatory steps to follow in every situation. Each situation varies from another in some fashion. In fact, trying to follow a lockstep mechanical procedure might get you into trouble with situations that require you to apply principles. But there are some situations that have a more defined set of phases to run through in order to be effective. Skills like solving a follow-up or post-op patient question on the phone are fairly well defined, are fairly easy to train, and are called near transfer principles. On the other hand, there are skills such as general problem solving that may be less defined, more difficult to train, and are called far transfer principles, with contexts seemingly remote or even alien to one another. Both involve problem-solving principles, but one is job and even task-specific, near transfer, like when to operate a cataract, while the other is broader in scope and more encompassing, far transfer, like the do not harm principle. While near transfer tasks are easier to train with greater probability of success, the doctor is limited to perform the tasks as taught. Far transfer tasks are more difficult to train, and the probability of success is lower, But once the guidelines are acquired, the doctor is able to apply the skills to a variety of job-related contexts. The key challenge is to identify the critical principles that best support optimal performance. I began with the example of the do no harm principle. Let's identify some more examples. To obtain clinical history and record main complaint, the doctor should follow important principles, like when to use open or closed-ended questions to identify the problems of the patient, how to use questioning techniques to direct the exam and gain information and insight. Handling complications or complaints require critical principles. Maintain presence, show empathy, address objections appropriately, and using check-back questions to check for agreement. When referring a patient to an attendant or subspecialist, the physician must establish the need and urgency level for special care and make the arrangements and follow-up. Not every case requires to follow the same reasoning. Like the white cataract needs surgery almost for sure, while in an earlier stage, there are several aspects to take into consideration, like age, lifestyle, visual requirements, comorbidities, and so on. You also teach principles to your patients. This is an example of a general rule for post-operative advice that a patient should follow when facing an elective but perceived harmful activity until they can ask the physician. When it does, don't do it. Well, easier said than done. Now let's go through some ideas on how to teach principles. Principles should be trained at the application level of performance. This means that trainees must practice successful implementation of guidelines in a variety of job-related situations, often presented as case studies. So, to teach principles, you need to provide the relevant guidelines, like the approved clinical guidelines. In ophthalmology, we have several sources, like those from the Royal College of Ophthalmologists. Another source, like the glaucoma guidelines from the American Academy of Ophthalmology, suggests the physician the initial evaluation and management. But remember, the guideline will not teach how to perform the elements, nor the order, nor the relative weight that each will have in the diagnosis or management of the patient. Providing the trainee with multiple examples in different contexts illustrates successful application of the principles to different situations. Also, non-examples can be used to illustrate the difference between successful and unsuccessful applications of the principles. And this could be a non-example. A diagnostic failure of narrow iridocorneal angle, aggravated by cataract progression and delayed attention, provoked an acute closed-angle glaucoma in this eye. Analogies are especially powerful in training of principles. But to work, the analogy must be familiar to the students and its critical elements must link meaningful to the principle. Like handling a complicated patient is like handling an egg. It's more familiar to more people than handling a complicated patient is like tuning a performance automobile. An analogy has to do with comparison of things based on those things being alike in some way. For example, one can make a draw or analogy between the seasons of the year and the stages of life. Death by bullet points is also an analogy that highlights the deleterious effect of using too much text on presentation slides, a practice that will kill the attention of the public, and a principle for effective teaching. Far transfer training may be quite more difficult, as it involves application of social skills such as supervisory or interrogation training. Is best taught in a classroom settings where video scenarios and role-playing can provide realistic examples and practice with feedback. And to summarize, we will go through the learning and teaching sequence. As usual, before teaching, you must define your objectives. To teach principles, the learning objectives should begin with the application-oriented verbs such as demonstrate, assess, criticize, evaluate, judge. Avoid remember-oriented verbs such as explain, describe, and identify. During teaching, the learning activities should include demonstrations with feedback, role plays, simulations, analogies, and plays. The suggested learning and teaching sequence is as follows. State the principle. Provide a statement describing the principle and any guidelines that flow from the principle. Provide varied context examples to illustrate the principle being applied. Illustrate the application of the principle in typical work-related situations. Provide examples where the principle wasn't applied and the resulting consequences. Provide analogies to build off of prior knowledge. Demonstrate the principle in a scenario. Provide practice exercise, role plays. Design practice exercise that will require students to apply the principles, not just recall them. Use at least 2 practice sessions. The first one encourages the learner to evaluate sample performance. The second session requires the learner to apply the principles taught. And finally, provide feedback. To evaluate principle learning, measure the participants' proficiency in meeting the skills criteria in context. Use role plays and skills performance assessment sheet to determine proficiency. This evaluation is better done by skilled evaluators using behavioral criteria. It is important to use behavioral checklists, that is, checklists that list behaviors that illustrate the principle in action, and that the evaluators are well trained in recognize these behaviors in action. Try to teach principles as much as you can, much more than formulas or data. Understanding is more important than memorization. Thanks for your attention.